Dr. Gottlieb, interesting challenges come with professional sports. Yes, we're not going to have any spectators, but you still do have to worry about the players, and you have to worry about the support staffs coming and going.
Yeah, they're testing the players in, so they're creating a bubble around the players. You do need to worry about the crowds that you're pulling together, the support staff that you're bringing in. There are outbreaks underway in that region right now, so you have to be concerned about that. Remember, Texas never really had an epidemic. They passed through the first wave of this, not untouched, but they were able to get through without a major epidemic. So they were able to stockpile medical resources, personal protective equipment. So they do have residual capacity right now to deal with this. But they have a major outbreak underway, and so does Arizona. And we talk about a seasonal effect here. Arizona and Texas probably have tipped over on the seasonal effect. It's in the high 90s in Houston right now. It's about 110 degrees in Phoenix. And so they're at a point in their season where people are being driven inside for air conditioning. And so they're probably not getting the benefits of the seasonal effect and people being outside more in those regions.
Do you call this a second wave, or is it too early to characterize it as such?
I think it's a continuation of their first wave. If you look at their curves, they never really recovered. They never really drove down their rate of infection. It came down, but not dramatically, and now it's going back up again. And so they've had a slow burn, and they've had persistent infection in both of those parts of the country. And as they reopened and people started to interact more, cases went up. I think the challenge for both of those states and other parts of the country, South Carolina's in this bucket as well, is that they really haven't been able to isolate yet the source of the infection. They don't know where these outbreaks are occurring, and it could just be that it's pervasive spread and it's a little bit everywhere, or there could be some isolated sources of the infection, certain places of work, certain activities, and they might be able to take selective action to try to quell these outbreaks. But right now, they don't have that information, and that's probably what's most concerning right now. They need to do that public health work to figure out where the infection's coming from.
Well, we're going to make you America's doctor tonight, then, Dr. Gottlieb. I mean, what would you tell residents in these states, if not the nation, about what they need to do tonight and here forward to try and mitigate the risk?
Well, look, the fact that they didn't have a major epidemic in the first wave or in the first instance probably bred a little bit of complacency there. I mean, I don't want to speak for the residents of Texas and Arizona, but you can surmise that there probably is a sense that, you know, they've gotten through the worst of this. And so they might not be taking the same precautions that people in very hard-hit cities are taking. So, you know, universal masking, all the things we talk about with hygiene, trying to limit your social circle, trying to limit the number of times you go to the store each week. All of those things help when practiced on a population basis, especially the masks. There's incremental studies coming out. There was one out today that if you wear high-quality masks across a population, you can dramatically cut the rate of spread in that population. Now, granted, if it's 96 degrees in Houston, it's probably getting difficult to wear a mask out and about all day long. But it does help if you can reach for universal masking. If we're not going to implement the population-wide mitigation, we're not going to shut down things again, you have to look for these more easier to administer interventions like universal masking, or else you're just going to have cases continue to grow.
Well, to that point, you've got now 21 states that are seeing a rise in cases, states that actually have persistent spread. You mentioned some of them, North Carolina among them, Florida, and Arkansas. Are we going to only see that number rise and spread further across the country?
Well, it depends on what these states do. I mean, if the states take targeted actions to try to contain the spread, in some of these states, it's outbreaks around certain facilities, and so they've been able to isolate it. In other states, they haven't, like South Carolina. North Carolina really doesn't know where their spread's coming from, Arizona, Texas. And so in the states that aren't able to isolate it, you might see the cases continue to grow. I think what we're more likely to see over the course of this summer is just, you know, persistent infection around the country and sort of a rotating cast of characters when it comes to where the outbreaks are, what cities, what states. But you're going to persistently have about 20,000 infections, and it's going to continue to grow, maybe go up a little bit as we get into August. And again, that sets up a lot of risk for the fall, that you could see cases start to grow really dramatically. And this wouldn't be unlike 2009 with H1N1. It's tracking pretty close to that season in terms of the tenors of this epidemic and how it's burning through the summer, setting up some risk for the fall.